Yes, testosterone replacement therapy is legal in Australia, but that's only part of the story. The government's subsidy rules are so strict, you can have every symptom of low T and still not qualify for affordable treatment. This is because testosterone isn't just a prescription medicine, it's also a controlled Schedule 8 substance. That means getting it without a valid prescription isn't just a health risk, it is a serious crime. So, how do you get treatment the right way? We'll break down the legal path, the real tests, the costs, and the risks you need to know. The first and only legal step is a prescription from an APRA-registered medical practitioner. This is a hard rule, not a loophole. But getting that prescription is difficult because the symptoms are notoriously vague. Fatigue, low mood, and brain fog overlap with dozens of other conditions. A general practitioner can be your starting point and can prescribe TRT. However, to get the PBS subsidy, they often need a specialist's validation. So, if symptoms are not enough, how do doctors prove you actually need TRT? The answer lies in a surprisingly detailed blood test. It's not just about your total testosterone. A proper diagnostic panel looks at free testosterone, SHBG, pituitary hormones, prolactin, and PSA. Why so complex? These markers tell the doctor why your testosterone is low. Is it a testicular issue or a pituitary problem? This detail is vital. And here's the divide. A doctor might diagnose you with hypogonadism at 10 nmol/L, but the PBS won't subsidize it unless you're below 6 nmol/L. This creates a huge treatment gap, leaving men with medical needs to pay out of pocket. So what are your options if you fall into this gap? Option 1, the public system. You might get subsidized care if you meet the strict PBS criteria, but it can be a slow process. Option 2, private specialist clinics. They specialize in TRT, offering a faster process and deep expertise, but you pay for it. These private clinics are the primary answer for men in that treatment gap. Those who are clinically low, but not low enough for a subsidy. So what does it actually cost? Annually, expect to pay from $1,300 to $2,600. This covers medication, doctor visits, and required blood tests. The most common form of TRT in Australia is testosterone injections. Clinics often prefer frequent, smaller doses to maintain stable levels. It is vital to understand. For most men with a confirmed diagnosis, TRT is a lifelong commitment, not a short-term cycle. Now for one of the most significant side effects, infertility. TRT signals your body to stop its own testosterone production, which also shuts down sperm production. If you plan on having children, you must discuss this before starting. Medications like HCG can be used to help maintain fertility, or you may delay treatment. Another complexity is the medication. TGA-approved products are regulated for quality, but compounded testosterone is not and can vary in potency. Remember that detailed initial blood test? That same level of vigilance is required for your entire treatment. It is not a set-and-forget therapy. This monitoring is how your doctor manages side effects, like an increase in red blood cells, and keeps your hormone levels in the optimal range. So with all these hurdles, why do it? When done correctly, the benefits extend far beyond the gym. We're talking improved mood, motivation, and energy. Let's clear up some myths. Medically supervised TRT is not illegal steroid abuse. Therapeutic doses are designed to improve mood, not cause roid rage. The strict legal framework and medical supervision we mentioned are precisely what separate therapeutic benefits from the dangers of abuse. So yes, TRT is legal in Australia. But it's a serious medical path governed by strict rules, complex diagnostics, and personal commitments. The most vital thing to understand is the gap between a clinical diagnosis and eligibility for a government subsidy. Success requires thorough testing, expert guidance, and a clear understanding of the costs and long-term commitment involved. And you must have an open conversation with your doctor about serious risks like infertility before you begin treatment. Knowledge of this entire process is your best tool. It allows you to ask the right questions and find a doctor who will manage your health responsibly. If you're experiencing symptoms, the only safe and legal first step is a consultation and blood test with a qualified medical doctor. Do not self-diagnose and never seek testosterone from illicit sources. The risks to your health and your freedom are far too high. TRT is a powerful tool when used legally and correctly, But mastering the system is the key to obtaining its benefits safely.